Hello, my name is Guy. I'm a paramedic student with Heartland and the McLean County Area EMS. I'm just going to answer a couple questions we got laid out for us here today. So, as a paramedic, it's my role to kind of assess, stabilize critical patients before transporting them to the hospital. So, in a nutshell, that kind of means recognizing and treating all forms of shock, cardiogenic, neurogenic, um, hypovolemic shock, things along those lines. So I need to keep the patient hemodynamically stable and with a heartbeat and be able to breathe for them potentially and keep their circulation ABCs in check. And do that the best of my ability. So not allowing patients to fall behind or something like that is also kind of in one of those areas as a part of that as well. Um, and then once I get to the hospital, there's that transfer of care, which is kind of where your field and my field intertwine. Um, Part of that, I have to basically just quickly and effectively provide information that I obtained on the scene with the patient and kind of sift out what's pertinent and what's not pertinent and give you the best picture as to what happened to the patient to get them to where they're at now and putting the patient's symptoms, collecting them in a way that kind of gives you a nice, clear picture of what's going on. So that kind of leads into the next point, which is interprofessional communication, how I can contribute to that. So it all kind of starts with the radio report, calling in, letting the nursing staff and the physician know what we got coming in, calling certain alerts if necessary. So sepsis, trauma, STEMI alert, any of those things, calling those in ahead of time, fast or a neuro alert as well, to let the incoming care providers or the care providers who are going to take care of that patient, give them time to set up and get ready for that transfer of care. So kind of preloading the system in a way. Um, and then also while on the phone, giving just basically bullet points of the important stuff. So tell them how the patient is presenting, initial impressions, um, vital signs, the patient, a little bit about patient demographics, age, and gender are the really only the two important ones. Um, and then also anything that we did en route or we've done before calling, anything that we plan to do, and if we have done something, how the patient has responded to that. So if we end up, starting a line, hanging a bag of LR, we can state and show how the patient has improved um, or the opposite if they haven't improved, if they stay the same, worsened, things like that. Kind of get a picture of what stage the patient will be when we get there. Then the next portion will be when we actually give the in-person report. So when we start there with the patient, you're starting to get your hands on them, you're starting to get your things hooked up. I can kind of give a little bit more of an in-depth thing, and you can have more opportunity to ask me questions. Because while you're there, that's your point in time to get your initial impression, sort of. You get to see what the patient's skin condition's like. You get to see the patient's mental status right there in front of you. And then it gives you opportunity to ask me questions. Um, yeah, so I mean, I've only done a couple clinicals so far, but it seems like the most successful interactions, they get the paramedic gives out some information, and then the nurse is able to internalize or understand that information and ask a few questions back, and it kind of the paramedic initiates it, but then the nurse is able to kind of direct the flow of information by what questions they ask. Um, and then the next portion here, so what are my expectations for working collaboratively with the healthcare with another healthcare provider, excuse me. So I don't really. have a whole lot of expectations except just to kind of be able to learn, at least within this assignment, how you guys operate, what your criteria is, what kind of things that it's useful to know coming in. Um, because there are certain things that you can find out yourself from the patient that maybe you don't need me to tell you. And then there's those other things that I kind of take for granted since it's something that I saw on scene while I was interacting with the patient that you don't know. So just kind of formulating how to provide that kind of information back and forth. I think that would be really helpful. But yeah, that's pretty much all I got. Looking forward to getting and seeing you guys' videos as well.